Welcome back to my YouTube channel Beyond Sickle Cell with Liz. So today I'm going to talk about two devices that has really helped me in the management of sickle cell disease and keeping away crisis. So the first device is incentive spirometer. So this is how it looks like. And then the second device that has really helped me is this one, the hot water bottle, and this one is its cover. So let's start with the incentive spirometer. So for the incentive spirometer, last year when I was admitted, I had a difficulty in breathing. I could not breathe well, and they had to put me on oxygen so that I could breathe well, because my heart was not, oxygen was not reaching my heart well. So yeah, I had to use oxygen. So later my doctor diagnosed me with pulmonary hypertension. So when I was diagnosed, my doctor suggested that I start using this one while I was still in hospital. So they prescribed for me this one. So when I started the exercise, this one is just to help to expand your lungs, especially after long hospitalization, or maybe you've had a surgery, or maybe you have a breathing problem. Your doctor will mostly prescribe for you this one. So to use this one, first you just fix this one here, and then this one, because when it comes from the box it has been removed, so you'll have to return it so that you can use it. You fix it, and fixing it is very simple. So this is how you use it, and you have to put it above your chest. So when you start, you don't need to pull all these balls to go upward. So you can start with one ball or two, three, depends with how you breathe in. So for each roll, like this one, it is 600 cc, and then the second one, it is 900 cc, and then the third one, it is 1200 cc. So with this one, it also builds your respiratory function, and then it also improves your lung function, because when you breathe in, your lungs will expand. It will expand. So it's really, this device is really important. You can see that it just looks simple, but it really plays a role in your lung function. And then for this device, because you'll be using it every day, though for me I use it maybe thrice in a week, because sometimes I'm always busy that I can't find time to come and do the lung exercise. So because you will be using it, so you need to clean it. So for cleaning, I'll just take warm salty water, and then you wash it, and then later you rinse it, because the water maybe it will be inside this pipe, so you can just rinse it like that. And then for this one, you take a clean tablecloth, and then you wipe it, the one that you use to dry your utensils. So you dry it very well, and then after that you just remove it, and then you put it back inside your box so that you can use it again for your next use. So for this device, it is recommended because the National Lung Health and Blood Institute in the sickle cell guidelines, it was recommended that, for example, for a person living with sickle cell disease, when they have a vaso-occlusive crisis, maybe this crisis has started from their back, they'll be given this device in the hospital, and they will need up to 10 breath, interval of 10 breath after every 2 hours. So after every 2 hours, they will need to use this device. So for Mercy Hospital in Kansas City, they developed a policy whereby when they get a sickle cell patient or children and they have a vaso-occlusive crisis, maybe it has started from the back, they'll be given this device after every 2 hours, so that it will prevent that crisis from developing into acute chest syndrome. So you can see the importance of this device. So I'll just link the link for National Heart, Lungs and Blood Institute, so that you can see in their guidelines the use of incentive spirometer. And then I also link the one for Children Mercy, whereby in the hospital they usually give sickle cell patient or children whenever they have VOC crisis. So for my next device, I'll talk about the hot water bottle. So with hot water bottle, this hot water bottle has really helped me a lot, because with this one, you just put your hot water in it. So what I usually do, I'll boil my water, and then after boiling my water, very hot water, the one that is really boiling, the one that you can use to defeather chicken. So I'll put that hot water here, because this one is 2 liters. So after putting here, because it has this lid that you have to close it very tight, so that it will prevent the spillage. I'll just tighten it, so that after putting my hot water here to prevent the spillage, and then after that I'll come and take this cover. So for this cover, I'll just make sure that the hot water bottle is inside this cover to prevent it from burning my skin, because you cannot put it directly. But if you don't have this cover, you can just use a towel or a cotton cloth, so to wrap it, so that it doesn't burn you when you are using it. So after, just, you see now I've just closed it. So after, now let's assume that I've filled my hot water here, and then I've tightly closed the lid, and then after that I've put my cover for the hot water bottle to prevent it from burning me. And then later, for example, if it is my chest that is hurting, or I have some pain, I'll just put it there, and then I'll just relax. So for this one, it's very important for people living with sickle cell disease, as it relieves the pain. For example, when you have a sharp pain or joint pain, and you don't want to use your painkiller, like for me mostly, I always avoid using painkiller if it is a crisis that I can manage at home. For example, maybe mild crisis. So let's assume that my joints are paining, or my chest, I'm having pain in my chest. So what I'll do, I just fill this one with hot water, and then after wrapping it with this cover, I'll just put it where it is hurting, so it will relieve that pain, and I will end up not using painkiller. And then what this hot water bottle does too, it improves circulation, because for example when I put it, maybe it is my joint that is hurting, that vein will expand, and when it expands, the sickle red blood cell will start moving well in my blood vessel, so it improves the circulation. And then the other thing that it does, the benefit that it has, it relaxes my muscle because, for example, because I'm using the heat therapy, so by putting it in my body, that heat will relax my muscles, it will improve circulation, it will relieve the pain, so I'll just relax. And when I relax, that crisis will start going down. And then it also provides distraction, because now I will not end up thinking about how I'm feeling pain, I'm not feeling well. No, it will give me that distraction. And then it will send the sensory feedback in my brain that right now I'm not feeling that pain. So by giving me that distraction, that means that my pain will also go down. And then for safe usage, just make sure that you've used a cover. Maybe if it doesn't have a cover like this one, you can use a towel or a cotton cloth so that you cover it. Because if you use directly like this one, maybe it doesn't have a cover, this one, it will burn your skin. You see, it will burn your skin because the water is very hot, 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 hot. And then also have to make sure that you check the temperature. Sometimes maybe if you put warm water, that one will not give you that benefit as someone who is using hot water. Because when I use warm water, I'll not feel that heat, and I'm using heat therapy to manage my sickle cell crisis. So you have to check the right temperature. And then, as much as I'm using this one for heat therapy, for example, I'm having a pain crisis, maybe it's mild, and my joints are aching. So as much as I'm using this one, I'll still take warm water or slightly hot water, and then I'll also drink it, so that this one will give me heat and the other one will also work by going inside my body, so they will work hand in hand. So these two devices are really important, and if you are a sickle cell warrior, maybe you can talk to your doctor and ask them if they can prescribe for you this lung exerciser or incentive spirometry, so that it can help your lung health. Because with people with sickle cell disease usually have a lot of respiratory problems, such as breathing problems, shortness of breath. Yeah. So for me, these two devices, they have really been helpful to me, and I really love them. And then also the those sickle cell warriors, during their menses, they usually have painful menstrual periods. So like they'll take painkillers, but they'll still have that pain. So I can just advise them, just go and buy this hot water bottle. It will really help you and see changes. You'll not need to use painkillers anymore, because this one, like, it will expand, it improve circulation in your body, and that heat therapy is really needed. You know how heat is important in sickle cell disease. So this one I bought, I think it was around 1000, but it was long time ago. I bought it at Chandarana supermarket in Eldoret, Rupamol, but it was long time ago. I can't remember the year. And then this one I was given at MTRH Eldoret. That time I was admitted, so it was part of my bill. Yeah, so I don't know the price, but you can check in maybe Jumia, Kilimall, and even our local pharmacy, I think they have it. Yeah, you'll find it there. So thank you for today. I hope I'll see you in my next video. Bye.